So, what happens when you lop out one part of the immune system, like the tonsils or the adenoids? Anyone who's studied tonsillectomy and polio in the 1950s knows that if a child had a tonsillectomy, they had between a 6 and 16 times higher rate of developing bulbar polio. That's the kind of polio that affects the brainstem, that would put you on an iron lung and potentially paralyze your respiratory muscles. And that effect would persist for 12 years after the tonsillectomy. So here we see a study from 1984, raising questions as to whether or not tonsillectomies also increase meningococcal carrier status and decrease a person's ability to fight off invasive meningococcal disease. Christensen studied 75 patients and cultured the throats before and 3 months after the operation. He also studied 68 healthy controls who kept their tonsils. The results caused him considerable concern because about a quarter of the Neisseria meningitidis negative patients became positive, but none of the negative controls who didn't have their tonsils out became positive over the 3 months. Doctors should have been aware for at least 75 years that tonsils are a first-line defense because of what happened with provocation polio after tonsillectomy. The same happens with the potentially nasty Neisseria meningitidis or meningococcal bacteria, as well as other microbes. The tonsils and Waldeyer's ring are an important defense that should be protected, and we should learn how to heal them and make them work better, not cut them out.